Did you know that about 10% of people I see in clinic with either extra heartbeats or missed heartbeats have an underlying heart condition? So when I see a person in clinic with these extra beats or missed beats, I usually ask 4 questions to establish whether these sensations are something serious going on with the heart or not. It's really common at night for people to be lying in bed and notice these extra beats or missed beats. So normally when you exercise, what happens is your heart rate goes up and these extra beats get suppressed. However, if you have an underlying condition with the heart, such as scar on the heart, then typically what will happen is these beats are not suppressed. And that implies that there is something underlying that needs further testing. So typically that'll be with a heart monitor and also a cardiac MRI scan to look at that potential scar and then work out what the issue is so you can be treated further. The second thing that I ask is, when you get these extra beats or missed beats, do you feel faint or woozy? Or even worse, do you collapse? Because if that happens, that suggests that you're not getting enough blood up to the brain, and that implies that the heart is not able to pump blood up to the brain adequately. And that gives you this sensation of dizziness or wooziness. And that clearly needs to be checked out because it could well be that there is something serious going on that is causing these extra beats. The third thing I ask is, do you have shortness of breath or chest pain? Because if you're breathless, it may be that you have a heart valve issue. You're not getting enough blood around the body, around the lungs, and that is causing your issue. Or do you have chest pain? Because that may mean that you have a blockage or a narrowing in the heart, and that also needs further investigation. And the fourth thing I would ask is, and this is not as common, but is probably the most serious, do you have a family member who's suddenly died under the age of 50? Because that may well be due to an underlying genetic issue. And that may have caused something we call VF or ventricular fibrillation, where the heart doesn't contract in a coordinated way. And that causes the person to die suddenly. So, in the vast majority of people with these extra beats or misbeats, there isn't anything serious underlying. But I think it's really important, and I always ask these 4 questions when I see people. Firstly, do they go away with exercise? Secondly, do you feel dizzy or woozy, or do you collapse? Thirdly, do you have chest pain or shortness of breath? And fourthly, do you have a close family member who's died at the age of under 50? So if you have any of these things, I would strongly encourage you to go and see your GP, go see your local cardiologist. Thank you very much for watching this video.